Hey guys, it's Sam, and welcome to Caps Lock, a podcast designed to help you live bigger, better, louder, and longer. Before we get started, I just want to thank you guys for listening and for giving this a chance and for coming here in pursuit of your best self. This is a space where we are going to grow together, and I hope that it helps you go forward confidently, unapologetically, and with purpose. It's time to live your life in Caps Lock. If that mission feels aligned for you, hit the subscribe button so you never miss an episode, and let's dive in. Today's guest is a double board certified surgeon specializing in ENT, head and neck procedures, non-invasive cosmetic injectables, and facial, plastic, and reconstructive surgery. He also serves as clinical assistant faculty at Albert Einstein College of Medicine and current treasurer and president-elect to the New York Facial Plastic Surgery Society. That is so sick, by the way. That sounds so good.
Nice.
He recently went viral on TikTok for his trademark tip stitch rhinoplasty, a specialized procedure that's far less invasive than a complete nose job and focuses solely on lifting the tip of the nose. He's been featured in Vogue, Forbes, Harper's Bazaar, Marie Claire, Women's Health, and more to talk about his work. And today he's joining us on Caps Lock to tell us all about injectables, what these things are made of, what are the pros and cons, what are the risks, and much, much more so that we can make informed and empowered decisions for ourselves going forward. Please join me in welcoming to the show, Dr. Michael Bassiri-Tehrani. I used to be the queen of searching my symptoms on the internet and going down a rabbit hole of terminal illnesses that I definitely didn't have, but would then lie awake worrying about for weeks. As I reinforced that habit time and time again, the line started to blur between when I should or shouldn't take a symptom seriously. I mean, even if your symptoms match up with a diagnosis on the internet, everyone experiences health issues differently. So there's no way to know if you've got the same thing as that girl on TikTok. But now I know that knowledge is power, so I'd rather see a doctor right away to either soothe my unfounded concerns or get the care I need. And that is where ZocDoc comes in. ZocDoc is a free app and website where you can search and compare high-quality in-network doctors and click to instantly book an appointment. I've used ZocDoc to find all my medical doctors, and it has been a total game changer because I used to have so much trouble finding the overlap between who's a good fit for me, who takes my insurance, and who's available to see me. So take back the power, stop putting off those doctor's appointments, and go to ZocDoc.com/capslock to find and instantly book a top-rated doctor today. That's ZocDoc.com/capslock. ZocDoc.com/capslock.
Thank you for having me, Sam.
I'm so happy to have you. I just realized I never say your full name ever.
It's a lot to say, so we just say Dr. MBT.
Totally.
Or Bassiri,
I feel like I walk in and I go, "Hey, doc," every day.
It's totally fair, yeah.
So much easier. Well, extra thanks for being here because you and your beautiful wife just had a baby.
Yes, like literally 2 weeks ago.
Are you awake?
Yeah, I'm functioning.
All the time.
Yeah, and if you're talking about aging and anti-aging, don't have a baby and move in the same 2 weeks. You will age significantly.
Oh my God, poor Alana. I'm like stressed for her thinking about that.
No, she's fine. She's taking it like a champ. She's awesome.
So chill.
Yeah,
I can't believe.
Yeah.
Like, well, it's probably like a good time to be like nesting.
Well, yeah, we couldn't really like set up things the way most people would, so we're doing it all like right now.
Oh my God,
that finally got into this space, and it's great.
That's crazy. Guys, for the sake of transparency, and so you understand why we're so comfortable in a room together, Dr. Bassiri is my Botox guy. I went in, like 2 or 3 years ago, wanting 2 years, 2.5.
Yeah,
somewhere
like
in
that.
Between, wanting Botox. We actually did a tiny bit of Dysport instead, I believe.
We'll explain. It's like Coke and Pepsi, almost the same thing essentially.
Totally. And I remember you like told me so much about it because I had 400 questions.
Yeah.
And that's the kind of information I want to share on the show today because our girls are not just like, oh, should I get Botox? It's like, what ingredients are in the Botox? What are the long-term effects? So let's just dive right in. And I think we should start with Botox because I think that's where like most people are most comfortable starting.
Yeah, it's the easiest like first step that most people take when they're going into like the plastic surgeon's office, dermatologist's office. Like that's more medical, I would say.
Yeah.
So it's totally common.
Okay, cool. Well, so what's it made of? What's Botox, Dysport? Like, I don't know what the other
So
brands
right
are.
now, I mean, there are more and more of these products coming to the market, but the main ones in America right now are Botox, Dysport, ZMN. Those are really like the big three.
Okay.
And they're all variations of botulinum toxin. So yes, that sounds scary.
Sure does. And
So
everyone, by the way, in my DMs is like, oh, I don't do it because of the toxins. And before we continue with like the ingredients of Botox, et cetera, can you tell me literally the definition of the word toxin? Does that immediately have a connotation of it's unhealthy?
I mean, it's basically a molecule that has an effect on the body, and
Okay.
the term toxin that's used like colloquially out and everything, oh, we need to rid our body of toxins, it almost has no definition. It's like very hard to pinpoint, and a lot of like wellness gurus will like mention, oh, you need to detoxify, but it's very amorphous, and unless you're getting specific about what you're detoxifying, it almost means like anything and everything. So
Yeah.
it's kind of too broad to really be useful in a lot of ways.
Okay, sounds good. So I feel like I don't necessarily need to be scared of toxin until we know what kind of toxin it is. So feel free to keep
Well,
going.
basically, I mean, a toxin is something that's not good for your body, or maybe not made to go into your body. It's not found in your body. And we're constantly exposed to toxins in our lives all the time. Like you can even consider like perfumes a toxin. I mean, they're not really like, it's not meant for your body. These leather couches, they might be letting off some fumes that are not meant for your body. But it depends on the dose of what you're exposed to, how long you're exposed to it, and if you have certain susceptibilities to having a problem with that toxin. Now, botulinum toxin itself, so back in the 70s, there was botulism. And, anyone who went to med school in the US knows that, like, they test you on this like crazy. How does it work? Because it is a bacteria makes this botulinum toxin, and it was found in kind of like canned goods. So if you ever heard like don't eat a can that's dented or bulging, it's because back in the 70s there was this Clostridium botulinum bacteria that would make a lot of botulinum toxin that would go into the cans. People would eat it, and it's a muscle paralytic. And if you have a lot of it, it will paralyze the muscles in your body, and people died. And it was a real problem. So don't eat dented cans for
Got
sure.
it,
Any
yeah.
food from dented cans or bulging cans. The dose of that toxin that's given for like cosmetic treatments is like a millionth of it. It's
it.
very, very minute. And, any medicine you take, if you take it at a high enough dose, could be toxic and can potentially kill you or harm you. So the dose that's being given and the way that it's being administered, you're not eating it, you're injecting it in specific muscles. It has very useful medical applications beyond cosmetics too. And in fact, it was used for medical treatments well before it was used for cosmetic treatments.
Right, like I've heard people using it for TMJ and migraines and stuff like that.
Even before that, it was used. So when I was in med school, I was in my neurology rotation. We're at Mount Sinai, and certain movement disorders. So there's something called dystonia, where your parts of your brain are causing certain muscles to become overactive, meaning I'm moving my arm, I'm flexing it, I have total control of it. But these patients have this like bicep muscle, for example, it clenches and does not let go and spasms, and it's from the brain. And it's extremely uncomfortable and painful because you're not meant to flex that muscle
All the time.
24 hours. So the only relief that these patients would get would be to inject Botox, and it was actually literally Botox, into the muscle. And because it's a bigger muscle, it'd be a pretty larger
lot.
dose compared to what you would get in your face. And that would basically paralyze the muscle or weaken it, depending on how much you put in, and give people relief. And from there, it started to spread and become injected in other parts of the body. I think at first in the 90s, it was someone injected around the eyes and noticed it smoothed the crow's feet. So it's basically very dose dependent. It's very, very well controlled how much of dose is in each of these vials. It's very, very regulated as well. So, these horror stories that you'll hear, and there have been a few of people getting like actual botulinum and like really sick from their injections, could be because it was like a batch that was either wrong, but that's very unlikely. It was imported and it was illegal Botox. Hot
Sure,
word,
like
right?
black market Botox.
Yeah, seriously. And yeah, and there were actually reports of people buying Botox from China, and it was like clearly in a counterfeit box. And like the person injecting it, I mean, there's no way they didn't know. I mean, they're the ones buying it. It's a very tedious process to get set up with the companies to buy the toxins. And
Right.
so they must have
And
known.
in theory, you're trained to know
Allegedly,
what
they must have
Botox
known.
looks
I mean-
like. Right. I had a follower ask in the question box on my Instagram story. She was like, I had botulism one time from Botox, and now I'm like too scared to ever go again. Can you tell me, like,
Yeah.
botulism is like the paralysis experience, or is it?
So
what is it
I
actually?
would have some follow-up questions to know exactly what's going on, but
Sure.
like yeah, if it spreads to other muscles that you don't want it to, I mean, technically it's botulism. There was someone recently who we had heard of who got one of these injections, and we don't know what product was used, and it spread to like the muscles of swallowing. It could even affect the muscles of breathing. So that's like a direct spread. Botulinum is more like if you ingest it and it goes through your whole body and eventually gets to the diaphragm and people can't breathe. Now, that sounds
Sure.
super, super
Yeah,
scary.
sure does.
This is not what's happening. You would
Yeah.
have to like spend like $1 million of Botox probably to get that level of toxin into your
Right.
body.
And is that like when people are scared of like the toxins in Botox, is it mostly that particular toxin, or are there other ingredients and things in the Botox that people are
Great
generally worried
question.
about?
So that molecule, in order for it to kind of function, has to be bound to a protein. And these different manufacturers, they're not exactly the same. Botox, there's like oncobotulinum, and there's different like slight variations that kind of makes them their own brand. They're all bound to a protein, and some of them have a larger protein that's bound to them. Some of them have a smaller protein. So Xeomin is one of the companies that for a while was promoting to be like a more natural one because it had a much smaller protein by weight attached to the actual toxin itself. And the thought is that those additional proteins can cause not autoimmune, but antibodies to form against it. So you're forming antibodies towards the protein that's binding the actual toxin. So over time, the effects might be less strong or less effective.
Okay, so that's another question we got, which is like, so let's just use me as an example because I don't care about HIPAA. Is with
It's all on the table now. Right?
Yeah, I'm like, everyone knows.
Yeah, exactly.
If I start getting Botox, I think I was like 25 or 26 when I come in. When I'm 50 getting Botox, will I need more like units or whatever you call it, like a larger dose of Botox to get the same effect? Or no, because the muscle's getting weaker?
Both simultaneously. So it's possible. So really the effects of it weakening and not working as well are more if you're putting a higher dose in. That's something about that triggers the body's like kind of immune response towards it to kind of block it with antibodies. And that was a problem with dystonia patients because you're putting so much into the muscle. Now there's all this extra protein in the body. At some point the body's like, hey, wait, there's something going on here.
Right.
Let's like
React.
Yeah, react.
Sound
Otherwise
the
it's
alarm.
kind of the lower doses, maybe you're flying under the radar, or at least that's the theory. And spacing them out so that your muscles have full time to recover. And yes, if you're repeatedly dosing this every 3 months, basically the way it works is it's blocking the activity of the nerve to the muscle. So the nerve is no longer able to release the neurotransmitter into the muscle until it can regenerate new little nerve endings. And that process takes about 3 months. So
And that's why you're supposed to get Botox like quarterly
you're
or
not
even
supposed
longer.
to, but you don't want to dose it earlier than 3 months and just keep hitting it because then that can cause some resistance. But also you don't want, if you keep repeating the dosage, what happens is it's essentially like that muscle never gets the nerve input back into it, and then it can start atrophying maybe a little more regular, and like it'll last longer because the muscle's not working as well. But I don't know if that's the best take, and especially early on if you're just looking for some reduced activity. I mean, look, bottom line, the way it works is kind of mechanical and silly. You can't lift up and make these faces, so your skin won't crease in the exact same spot. When the muscle activity comes back, it may not be moving in that same exact configuration either. So
interesting.
So instead of having like 4 lines that are creasing when you lift your eyebrows, you might have 5, but in like different spots. And
got it.
It kind of gives that creased area a little bit of a break, and hopefully that smooths out. If you're young enough where you don't have any creases, you won't notice really the creases forming as early.
Right. I think the way you explained it to me the first time I came in, because you remember how like gun shy I was like, do almost none.
Like everybody. And
yeah,
everybody the first time is very sensitive to the product, and it's like a new experience. So you'll feel stiff. You'll feel like, whoa, it's an interesting feeling, which goes away after a couple of days to a week usually.
Yeah.
And, after a couple tries or a couple treatments, it's not as intense.
Yeah, well, the third time I went, I was like, hit me. It was like very different experience. But yeah, there are 2 things you kind of explained to me that speak back to what you're talking about now, which is, one is you were like, if you fold something enough times in the same place, the crease doesn't go away anymore. Like you open it up, you flatten it out, and the crease is still there. That's like what happens with wrinkles on your face. You're using the muscle the same way for 20 years, 30 years, 40 years. And so a crease starts to form in that one spot, and Botox basically freezes the muscle, so you're not making that exact crease anymore. And ideally, it goes away, right?
That's exactly the idea, yeah. And yeah, so it's basically if you just keep bending a piece of paper in the same way, and eventually you'll have a crease. And then if you stop bending the paper because you now put Botox and it stopped moving, the crease is still there. You still have to do maybe something else for it, or it takes a long time, like 2 years for it to like kind of smooth out and soften.
Well, and that's why people do like quote unquote preventative Botox, which is like what I came in for. Obviously, I was 25. I didn't really have wrinkles on my forehead, but I was just starting to see I have a very expressive face, as you know. And so like my eyebrow mobility is like amazing, but I was starting to see like little fine lines just like above my eyebrows. And so we went in and talked about like, I ultimately don't want wrinkles there.
Yeah.
And also like something my mom has complained about over the years is like, both of us are very like furrowed brow, computer work all day long.
Yeah.
And we both tend to like pull our eyebrows together. And she's complained over the years about having a crease right in between her eyebrows. And so when I came to you, I was like, I want to prevent those things.
Yeah.
And I have a lot of questions from people like, is preventative Botox a thing? I mean, I feel like, yeah, because that's what I did. And I like what happened.
First of all, nobody likes that crease in the middle. It's just like, nobody misses it. No one complains that you hit it too strong. Right. It like makes people look a little angry and unapproachable. And if you're in a position like a job where you're like front facing or in sales, it may convey the emotion that you're not having. You might look angry when you're not. And to a certain extent, you might even, if you're making that muscular face all the time, you might start feeling angry just because you're making that angry face, and there's some feedback to the brain from that. So
that's a real psychological thing.
Yeah, relaxing that muscle actually can make people feel relaxed. And there are some studies of like the emotional kind of response to all of this.
Wow.
As far as preventative, when I first finished fellowship, it was like people were like, oh, baby Botox starting preventing and doing it younger and younger. And at first I thought, I'm like, this seems like a little bit of like a money grab. Like, yeah, totally.
People
and I'm
don't
like,
need it.
Like how, like what kind of like how unscrupulous are we really?
Right, like, are we doctors or are we used car salesmen?
And then in my own, like in the medical side of what I do, I saw there was a case one time of a patient who had hemifacial paralysis. So half of their forehead was paralyzed, and it had been paralyzed for medical reasons for about 10 years plus. And I'm looking at the skin, and you can see the side that moves had these deep creases. And then it kind of transitioned to like smooth baby skin on the other side.
That's crazy.
It was as if this guy had Botox in half of his forehead for 10 years. And then I'm like, okay, yeah, maybe there is something more to this preventative thing. And, if it's done right, if you do it in a lower dose and it's safe, then, preventing these creases from coming in might be the right way of going about it. And it's probably less invasive than waiting for them to come and then doing all these other things and chasing your tail. Once it's already set in.
Right, because like you said, if you have folded this piece of paper a million times, the Botox doesn't necessarily make the existing crease go away. It just prevents you from making it worse, right? So you'd have to like laser filler.
Yeah, the body will eventually smooth it out and figure it out. And, you could do facials, you could do some fillers sometimes, some resurfacing, and that'll make it go away depending on the depth. Also, not every piece of paper is the same thickness. So people with thicker skin may go longer before noticing any of these fine lines or wrinkles, versus someone with thinner, fairer skin may experience some crepey wrinkles or dynamic wrinkles from moving at an earlier age. And, there's when to start. Really, it could be once you start seeing the first signs of it, or kind of you can go by age and assessing how thick the person's skin is.
I also think that's partly where choosing a good practitioner comes in, because I've come to you and be like, oh, maybe I want this, and you're like, you don't need that. Yeah. And I think for me, part of the reason that you're the only person I'll ever let touch my face.
Wow, thank you.
You're welcome. So when I'm 75, you better be still working with that needle, and I want you flicking that needle immediately for me, because I'm terrified to let other people touch my face. But part of the reason for that is because you really err on the side of being conservative. I mean, obviously you're a doctor, so it's not like going to an aesthetic boutique chain place where people with needles are like, how much filler do you want? That's not how you work.
And there's some good ones, and there's people doing them that are very well qualified.
Sure, but a lot of those places are pay per blank, and you just tell them what you want and they do it. And one thing I loved about going to you was I was like, what do I want? And you were like, XYZ maybe, but let's err on the side of being conservative and take baby steps. And I was like, thanks, because A, that saves you money when you don't want something, but B, I'm not going to look overdone or crazy.
Yeah, I think every specialty kind of has its own way of doing it. I've seen that side of this space before, and I didn't like it.
Right.
I think that bigger places that are offering very low prices are operating on thin margins, and so they have to make that up with volume. And that, even the lowest level injector is going to be a nurse or a nurse practitioner, PA. They're still expensive people to have around. So if there's a company that's hiring them, they have to make their money somewhere. And versus my office, I went through so much training, and I didn't want to do the whole, this is how many units you need. No, just leave it to us, omakase,
sure.
Trust me, and we'll give you as much as you need, and that's that. And the whole price per unit thing, in my opinion, you get into these weird conversations of somebody thinking they need less, and then it doesn't work, and they want to come in more, and it's not very tasteful.
Yeah, and then also, I mean, let's keep going. I know that's not your intention, but it feels like a great opportunity to segue into say you get some, it doesn't work great, you are disappointed and you want to get more. What is up with layering product over product? I know Botox is a little different than filler in that way, and we have a whole filler conversation ahead of us, but with Botox,
I'll explain. Yeah,
what, I mean, you were saying when you come back too soon to get your second hit, it
you make it sound like heroin,
it's drugs.
Yeah. You, first of all, medically, you really don't want to put it in before it's completely out, because you can develop some resistance to it. So typically with my patients, if there's an injection and it's done and it needs a touch up, maybe there's some asymmetry or it's not strong enough, I will have patients come in within the first week or two to do a touch up. Beyond that, you're now getting in, if someone comes in 6 weeks later and they're halfway through their treatment, putting more in is going to cause resistance, and it's going to cause it to be kind of off cycle. So the part that you put in later may still be a little stiff when the rest of it's fading out. And
you're half and half, man.
Yeah. And, typically, like I said, the nerve endings that are going into the muscle, those get blocked, and new nerve endings are going in. It's not like a medicine that wears off. You're actually literally waiting for new nerve endings to go into the muscles again. And people don't really talk about that at all.
I really thought it was wearing off.
No, it's a permanent bind to the nerve ending. And the way that it wears off is new nerve endings grow into the muscle. So for that reason, personally, I like to wait the full 3 months or even longer, as long as it looks okay and patients are happy.
Yeah.
Let the muscle recover. I mean, there's nothing wrong with having a functional muscle. It's probably better.
Yeah. And people are so scared of moving their eyebrows these days.
And man, a part of that is because like the taboo of getting some of this has gone away, and it's so mainstream, and like it gets sometimes over celebrated.
Yeah.
To your question about layering products, so you can't really layer Botox. You can't really do. You can't really do off-cycle treatments. Some people sometimes do. I mean, there's different areas in the face besides the forehead, and here, like very niche areas like the chin, or sometimes in the neck. These things can be in a different area, but you ideally want to do them all at the same time.
Yeah. So follow-up question, when you were saying like not to be afraid of a functional muscle, I guess there are kind of two things I want to talk about, because I'm not sure if they're related or not, but people I think talk about them in conjunction a lot, which is, one, is it like necessarily a bad thing for the muscle to get weak over time? Like, does it have any like adverse effect, or do we just have like a bad connotation with a muscle weakening, and like it's not that big a deal if your forehead muscles are super active or not? And the kind of conjoining question is that related to, when people say like, oh, I feel like I got a heavy brow?
Yeah.
Is that related? Is that the same thing?
So these muscles in the face, besides expressing emotion, they're not really, there's not so much medical function. I mean, obviously expressing emotion is like a huge part of being a human being. And like, if you screw that up and screw up their smile, it's a big deal. But if, for example, I overdo the forehead and it feels stiff and heavy, besides it socially being a little off, you're going to have a very functional life. It's not a problem.
Right.
Unless I'm doing it in someone who is old enough where they've lost support in the eyebrow. So your eyebrows are kind of fixed with some connective tissue to the orbital rim, so this part of the skull here. And starting usually in the 30s on, this gets looser and looser, and you get some heaviness over here naturally. Okay. And people don't realize this, but they're compensating with this muscle. So if this is starting to...
Wait, the one across your forehead?
Yeah, this is called the frontalis. Its job is literally to lift the brow up. So yes, in order to smooth these lines, you have to inject here, and then that will relax the muscle and it'll come down. People, younger patients who don't have any issues, brow stays where it is, no problem. If you overdo it, like really a heavy dose, then yes, the brow will feel a little heavy. And if they're an older person and they already have a little bit of laxity in their eyelid, a little bit of drooping of the brow's already in a lower position, it can cause hooding, and it will make it difficult for patients to put on eyeshadow. I've heard all these complaints early on, so that's why I know about all these. Like, and it will actually make people look older. So
well, and that's why people do like upper lefts
or brow lift. And knowing that I can do that for somebody gets me to be like, okay, look, maybe we shouldn't do this, and we can move on to surgery. Whereas a lot of other places or people who don't offer that might not have that tool in their ability, and it can limit, and they just keep doing
you either
stuff.
do it or you don't then, and you live with the consequences.
Right. And so I think patient selection is super important. I think that a lot of patients I have to explain to a lot of patients that this muscle is lifting the brow. So they think that, if you hit this, it's going to lift their brow. It's not. It's actually going to do the opposite.
Like when you're talking about lifting a brow, I remember I think I was in your office and someone was like, I just want a little pinch above the arch of my brow, so let's get some Botox there. And I remember thinking, you actually can't contract that muscle.
Yeah, you're not contracting it. You're actually doing the opposite. So the way you lift or do a chemical brow lift, so to speak, with Botox is the muscles around the lateral eye, so around the eye socket.
Yeah,
the crow's feet, exactly. Those muscles, when they contract, are actually pulling the tail of the eyebrow down. The muscles, the glabellar muscles that are pulling the medial the 11s or in between the eyebrows, they're also pulling the brows down. So if you weaken those, then you can have a release of the muscle up, provided you don't blast the frontalis or the forehead, so that there is some tone pulling up. It's kind of like a tug of war, and you're weakening one side. And
this is why it's an art. Like, you really have to know where to inject and how to inject.
Yeah, and people have natural asymmetries to their muscles, their face. They've had maybe injuries when they're children, scars, things that'll cause it to be different for each person.
To that point, one of the questions I'm getting is how do you pick a good practitioner? Like, what are the red flags or green flags that you should look out for when, I mean, like, go to Dr. Bassiri if you have access to Manhattan.
Just come to me. And
Literally.
don't even think about it. Right?
I'm not even kidding you. I will never let anyone else touch my face. Do you know how many emails I get a week of people being like, come in, we'll hit you with some free Botox? And I literally either ignore their email or I'm like, no, thank you.
That's like one of the red flags, maybe. I mean,
they're emailing you to be like, come in.
Yeah, if they're like very pushy.
Yeah.
And they're like, you need this, and this all at the same time.
Yeah.
Do you like really? And
they've also never seen my face in person, mind you.
Yeah, I mean, look, that's more of like an advertising grab. They just want to get anyone who can
in the door,
like anyone who can have a good following, promote their product.
Totally,
it's kind of, it's one thing to market, but it's another thing when a patient's there, and there's somebody pushing them to do something that they're not either ready for, or pushing them to do more than they're ready for,
or like, I didn't ask for this,
or bringing up things that they're not bothered by. So I'm not, if there may be a few things that I think I can do for somebody, I'm not bringing them up unless they're there for whatever it is, and if it's loosely going to help that problem, I may bring it up tastefully, but I don't need to make people like extra self-conscious about stuff like, they don't have just to do another procedure. It's
you can't be like, oh, we should do your nose while you're at it, and then that girl's like, what's wrong with my nose? Like, that's the worst thing I can think of.
Right. So you'll get a feeling, and you'll know. If I think the prices are like shockingly low, that's like, where is this coming from? Like, I'm like, how is this possible?
Right. What's your margin?
What your margins are, unless it's like hedge fund backed or something. I don't know.
Right. But it's like, how are you making money?
Right. And I think who's injecting makes a difference too. Like, as a surgeon, especially with filler, I've gone into people's faces surgically. Like, I know where these muscles and nerves and blood vessels are and like what they look like and all of that. So I can kind of visualize as I'm putting the stuff in where it's going. And there are some risks with filler, and we'll get into that. So I also have a lot more to lose than someone, it took me a very long time, and it was kind of expensive to get to this place and like set up my office and all of that. I don't function out of a van. So there's a pretty big like investment in my life right now. So I'm not going to do something dangerous and crazy. And, my patients know that.
Right. You're not going to risk it for $350.
Right. I like doing surgery. So like, this is like a fun, easy kind of bonus. It's a great way to meet patients and like get to know younger patients and all of that. Right. It's like an extra thing. You just got to be careful. And it's a vibe check, and you really have to connect with the person. If you feel like you can't communicate with the person, or they're not listening to you, another red flag. Maybe go get another opinion. Yeah. If what they're saying doesn't make sense, if it's very different from what you've heard from other people, just you take a pause. You don't have to do anything right then and there, no matter. And if they're like, no, you do. That's also like a red flag. Yeah. Most people should be like, look, okay, like think about it. Like, you're not ready. Come back when you are. Come back when your schedule's a little lighter and you can recover from this.
It shouldn't be so urgent.
Yeah, it's definitely not urgent. Absolutely not.
Okay, good. So I guess other than that, we have a couple like audience questions probably that we'll get to at the end, because the audience questions span a couple of different topics. But I guess the last Botox question that I have for you is like, what are the biggest mistakes you see when people go to get Botox? Like, what's the biggest mistake either the client makes or the doctor makes? Oof, that's my worst nightmare.
Oh, this is a good question. I think selecting who you go to, and I think how much and how often you're doing it. And it has to be tailored to each person. It's, as far as mistakes go with Botox, as long as they're using the right product and they're generally in the right area and they're not like doing anything dangerous, it's pretty safe. I mean, like,
it's hard to totally ruin.
Right, you're gonna look maybe at worst funny.
Yeah.
And that'll go away. It's reversible. So like, it fades out. It's not reversible, but it goes away. With fillers, it's a different story, and you could have some real problems. And so, like Botox, most of the time it's like, okay, that wasn't a pleasant experience. It wasn't good.
Totes.
Sidebar for a sec, it's Mother's Day season, which personally I celebrate all year round because moms deserve way more than just a day. And I wanted to take a minute today to thank all the moms out there for everything they do for us, especially my mom, because there is no me without you. Function Health just released a book called Long Live Moms as a reminder that moms need to take care of themselves too. I really loved this excerpt from the book, so I'm just going to read you a quick piece of it. Moms know sacrifice, love stitched tight. They toil, the grit, the sleepless nights. They hold the world yet stand unseen, the quiet force in between. The keepers of the scraped up knees, the magic hands that calm the seas. But wise are moms who pause, who see that caring starts with caring for me. A body strong, a breath drawn deep, a heart that beats, a soul to keep. The years move fast, yet love remains, a bond unbroken, thread through veins. So long live the ones who teach us how to love ourselves, to live well now. Long live the hearts, the wisdom, the care. Long live moms everywhere. If you are a mom or have a mother figure in your life, I'm sure this poem resonates. I feel like it's such a powerful reflection of the sacrifices a mother makes and the love and joy they bring into the world. I literally had to record this twice because I got choked up reading it the first time. If you don't know Function Health, it's an all-in-one health platform that helps you take control of your health through data. Instead of guessing what's happening inside your body, Function helps you know for sure, providing access to 100+ advanced lab tests. These tests include insights into thyroid function, hormones, liver health, heart health, autoimmunity, kidney function, nutrient levels, heavy metal toxicity, immune system, electrolytes, and more. With Function, your first set of tests helps establish a baseline of your health, giving you a starting point to compare future tests against. This makes it easy to spot changes, even subtle ones, and address them proactively. For all my moms out there, Function Health is the best way to care for you so you can continue to care for them. Get Function Health's Long Live Moms book for free at functionhealth.com/capslock and learn more about how Function Health can help you take better care of you. That's functionhealth.com/capslock.
Okay, let's talk about filler then. That was a great segue. You know, I'm just dying for perfect mouth. But my greatest fear is looking like I got stuck in my bee. That's my fear, is the pillowy, overstuffed, crazy look. So almost a year ago now, we did just the tiniest bit in my lips. And I remember waking up and being obsessed with my face. This is amazing. And then 4 or 5 months later, I was telling someone that I did a little lip filler and they were like, respectfully, I had no idea. And I was like, okay, but I felt amazing. Again, speaks to how conservative and you really were I'll do a little bit, but we're not going to go crazy. And I really respected that. But every other week I'm texting you please, can I do lip filler? And you always say no, which I totally respect, because the last time you touched the inside of my lip and you were like, it's not all the way gone.
Yeah, I think that with fillers, you can run into some big problems with overfilling. And I think in general, people are slowing down with the amount of fillers. I think fillers
people are dissolving them now.
Dissolving them is a big thing. I dissolve them. I have a nice ultrasound that I use to target the dissolving. Filler is more of an art, definitely more of an art than Botox is. Yeah. Essentially, you have various different filler products. So for people who don't know what filler is, it's hyaluronic acid gel. It's a gel that looks almost like aloe vera gel. It's thick like that.
Yeah.
And unlike Botox, which actually has some molecular activity, this has no activity. You're injecting it into a space. Wherever you inject it, it kind of just sits and hangs out there, and it will plump up, volumize, and just stay there until the body breaks it down into water. Hyaluronic acid is a normally occurring thing in the skin, so it's very natural.
People love it for a moisturizer.
And on top of it's in a lot of moisturizers and topicals, and it's very hydrating. It's super hydrating. Compared to Botox, there are a lot more products. Okay. And selecting the product is super important. And there's different thicknesses, there's different water binding capabilities, there's different kind of durations and cross-linking of these molecules that are done. So you have a lot of paintbrushes to choose from. And then once you have that paintbrush, you can do either a lot or a little with it. So someone who's very good and can camouflage shadows and knows where to put things and get the most out of one syringe of filler is going to have a nicer result than someone who may not know what they're doing. You can easily put 3-4 syringes in someone's face and not even see it. And this stuff is in the face, and depending on the layer of the face you're putting it in, it can block or put pressure on lymphatics. It can block or put pressure on blood vessels. That's a real dangerous. I mean, that's the risk. It's very rare if done properly, but you want to make sure you're injecting it in a safe place, not in a blood vessel. And
Okay, that is a big question for me.
Yeah.
Like when you say like injecting it into which layer, it's supposed to go right under the dermal layer, like right under the skin, or
No.
deeper, or what?
whatever you want.
So you can choose, but like there are different risks associated with like which layer we're talking.
More like different areas of the face is where the risks are.
Okay.
So to compare, I think that just under the skin is going to be more for like fine wrinkles.
Okay.
And just under the skin is where you find your lymphatics. So if you put a lot of product just under the skin, you may get like some puffiness, maybe some puffiness under the eye. If it's too close to under the skin, you get what's called a Tyndall effect, which is a blue kind of tinge to the skin, which typically will happen under the eyes because the skin is so thin that when light goes through the skin and it hits some filler, it refracts like a prism, and you get this like blue kind of look to it, and it can look puffy.
Wow.
So
The irony of like trying to fill your under eye bags and then
Right.
getting blue under eye circles.
yeah, exactly. So yeah, you could do things to look worse with this stuff.
Right.
You can also go deep onto the bone. So areas like the cheek, the chin, I like to go deep right onto the bone, and
Okay.
it almost acts like a liquid implant. And in that area, there's fewer blood vessels. There's less chance of it clogging up the lymphatics. Now, obviously, if you inflate it like a ton and it puts a lot of pressure to the point where your skin is like ballooning out, yes, that will cause puffiness. That'll look weird. You could still look weird if you kind of flare it out too much and make
Yeah.
someone look like an avatar. But like, you know, everyone has their taste. So you have to kind of make sure that the taste of the person you're going to aligns with what you're doing.
Yeah.
Whether you have friends that go there and they look good and, you know, they have had good experiences. If what they're explaining to you doesn't make sense again, or it doesn't,
Right.
like the goal doesn't look good, you have to check that out.
So let's talk back for a second about like blocking the lymphatics and potentially affecting blood vessels. I mean, it sounds horrible, right?
Yeah.
And we know that I can tell immediately that it's bad, but what does it actually do? Like when you block the lymphatic system, you get puffy. Does it prevent like toxins from leaving your body? Like, does it prevent the lymphatic system from actually working?
Lymphatic
And same for the blood vessels.
drainage. So like you've heard of like lymphatic drainage massages.
Yeah,
You
we
probably
talk
talk
about
about
it.
it here all the time. So your lymph system is designed to remove swelling and toxins from your skin and other areas of the body. It's just underneath the skin. And if you traumatize the skin, so anytime I make a surgical incision, there's going to be some blockage of lymphatics where we operate, and there's going to be some swelling, and the swelling may take longer if you do another surgery in that same spot, like the nose, for example. If you're putting a lot of filler under the skin to the point where it's like tense, like a balloon type of thing, then it's going to compress it. These are very fine structures, so it might not be as effective as flowing or moving. And you know, if you get a lymphatic massage or you're doing like a jade roller or the gua sha, you're actually like squeezing this stuff. Now, if there's all this other stuff kind of pushing in the
Blocking,
way and
yeah.
compressing it, it may not flow as well.
Okay, it feels like, tell me if I'm picturing it right. It feels like if you're in a car and the airbag goes off, it like squeezes you back into your seat and like
Yeah.
fills up the negative space. Like that's what I'm envisioning.
Kind of, yeah.
Okay.
So you have to be careful with how much you're putting directly under the skin. The actual, if you're using like a cannula, so you have needles, which everyone knows what a needle is. A cannula is kind of like a needle that's not sharp, that kind of crawls and spreads the product out under the skin. It fans it out very nicely, but it's like micro trauma to the area. So you want to be careful about overdoing that. I like to, whenever possible, inject deeper so that it's bypassing all of these. And lymphatics is one thing, and blood vessels is a different thing.
Yeah,
So-
let's hear what happens
So
there.
all of these fillers have a risk of either compressing a blood vessel or getting into a blood vessel. And if that happens, then it's more of an urgent situation. And that's a hard risk that every injector should be explaining to you at least your first time. And another red flag, if they're not mentioning
not.
these risks, like you
Sure.
need to know. Certain blood vessels will supply certain areas of the skin, and if you block them off, there may not be other blood vessels to supply that area of the skin, and it can get dusky, it can get mottled, it can even turn necrotic and blue and black and not survive.
Like your skin dies on your face.
Essentially. So there are like these horrific things. It's very rare. It's more risky in certain areas. Personally, I don't really inject the tip of the nose with filler. Some people do liquid rhinoplasty. Bridge is a little better, but if you get it into a blood vessel in the tip of the nose, you can have necrosis of the skin of the nose. That's a horrible thing to have.
Sure.
It's difficult to fix, and you have to reconstruct the nose. And if this happens and you catch it early and it's just a compression, by the way, all of these can be dissolved. If it's hyaluronic acid, there's an enzyme, it melts it away. You catch it early enough, probably not going to be a big issue. But there are, if you get like a direct hit into a blood vessel, so your technique may not be right, or you're just you're in the wrong place, or you're just unlucky, it is a risk. And that for filler, if you go to someone who's inexperienced, you can have a real actual problem.
Totally.
Besides just looking funny. The looking funny with fillers, you can melt it away, and that's really like a relief for patients. So I go very little.
Yeah.
And you can always layer it. So you could do a little and then come back in a month and do a little more. You don't need to put a ton in at once.
Yeah. So, okay, I have so many follow-up questions to go off of this. So the three are, I want to talk about the ingredients the same way. Like I know we talked about hyaluronic acid, but I want to know what else, and like what else is in there. The second one is layering.
Okay.
Like, okay, you put one layer in. If you put more in a month later, does it get like bumpy, lumpy? And there was one, and we have to talk about dissolving like separately.
Oh, yeah.
So let's do the ingredients first, and then we'll talk about maybe layering.
As far as I know, it's pretty much just hyaluronic acid and
great.
lidocaine. And so
That doesn't really feel super bad for you.
as far as clean ingredients go, it's not terrible. Now, the hyaluronic acid can be linked. I don't think they're like really preservatives. People don't have allergic reactions to this stuff the way they do with other medicines.
Right.
I suppose it's possible, but like it's
Rare.
It's less of a concern than many other medicines.
Okay.
It's actually not even a medicine. It's just not medically acting. It's a filler.
It just goes inside. It's like pillow stuffing.
Yeah, exactly. The lidocaine becomes an issue with breastfeeding and pregnancy. So you can't really take like lidocaine's not good. So as far as layering, I think that it's actually better to space these injections out.
Wow.
Once you start doing some injections and the needles go in, you immediately get a little bit of swelling. You might have some little bruising or blood collect under the skin temporarily.
In case anyone was wondering, I didn't have a single bruise when you did my tiny little bit of lip, so that's cool. Talent.
Thank you.
Thank
you were wonderful. Oh, it's a luck of the draw. Sometimes you're like come out like a genius, and then another time, like 1 out of 10 times you hit a little blood.
But I have like
vessel
the
and you get a
fairest, creepiest, thinnest skin in the world, so to not have bruises was incredible.
Yeah. Well, yeah. Also, fun fact: don't drink anyone before going to these visits. It will thin the blood, and you're more likely to have some bruising.
That's also great for my campaign against alcohol. That's great.
Yeah, I know. So yeah, this is for your people who are like need another reason.
Yeah.
Like you can almost tell when someone's had like some drink. You're like, why?
You're like, why is your whole face purple?
Like I use the smallest possible needle, and why is there like blood coming out? Like it doesn't make sense.
Yeah.
And they're like, oh yeah, I got like martinis last night. Like wow,
totally.
Like, maybe don't do that.
Yeah. Okay, but
so people get puffy.
Yeah, and this is amazing that you want to layer, but that's right, because you get a little swollen immediately, and then you have to see it settle.
Well, layer means putting product on top of product. I think spacing the product out is better. So
got it.
If your goal is to plump up your cheek, you can start with one syringe, let it heal, and then in a few months, these products last anywhere from 9 months to a year. And so if you go in and you do another session in a month, there's no limit like the way Botox has a limit. You can come in and do this like a week or two later, a month later, and put more in when the swellings come down, when we can see where it kind of settled out so that we can make sure there's symmetry. If you're like shooting a bunch of the product all at once, then maybe at the time it's more swollen on one side and you end up with some asymmetries. And then you already have all the product in, you already spent your money on the product. You don't want to do another one in a week. So I think spacing them out is important. Layering them, I think there's a certain order in which you might want to consider doing these things. Like a lot of patients will complain of their nasolabial fold, so like these kind of creases when you smile. I think that oftentimes you want to maybe consider doing the cheek before you start targeting that, because then A lot of it will look better with the cheek being lifted.
Got it.
The higher cheekbone will kind of give you the illusion of that.
So it's
being
really
better.
actually about like the balancing of your
You have to look at
features.
everyone's face and assess, like, is this going to, like, what is going to enhance this person's already natural face? I'm not trying to change like an oval face to a heart-shaped face completely. Like you can do little tweaks. You can't completely revamp the whole thing. You have to kind of lean into what the good qualities are and avoid overfilling to chase your tail with something that's not achievable. So the order in which you do it, maybe you want to do the cheeks, then you do here, so you don't get like this kind of like simian looking kind of face and like heaviness to the lower face.
Interesting. So I guess like it's funny because I think a lot of people. So let's use me again as an example.
Sure.
I remember going into you and being like, okay, if I do lip filler, I think I mostly want my upper lip. And you were like, we have to do both. Like if you're going to do
Yeah.
one. So like I learned that day and continue to learn from you that it's so much more about the harmony. And so it's like you can't just like pop in and be like, I think, one half of my lip is a little asymmetrical. Let's like pop some filler into that half.
Yeah, I think feedback and like information from patients is super important. So like if you do feel like one lip is a little higher and then the other, and there's something we could do about it, it's definitely worth discussing. Like with filler, you can't really fix that asymmetry. So like
Yeah.
I need to talk to you about that before we inject. Otherwise you're going to be like, it didn't work. And be like, what are you talking
okay.
about? Like it wasn't meant to fix the symmetry. You never mentioned that.
Right.
So I like to point out these things in the area beforehand. Otherwise it sounds like an excuse after and
Totally.
nobody's happy. There's so many different ways of doing it. But yeah, you have to really assess the person's face and like what you want might be different than what the injector thinks you should have, and that's a problem. So good communication, super important. Yeah.
Okay, so now 2 questions. First, we're gonna come back to dissolving because it's so important, but let's talk about migration.
Yeah.
Because that's my worst nightmare thing. And also a follower asked me, and I had never heard this before. She was like, is it true that filler literally never really goes away? And I was like, what the fuck are you talking about? I think that's terrifying. So is that true? And does that just mean it like migrates around your body and like spreads out over time, or what?
So it's
like,
not going to
what's
go
it
like from your face to your arm. All of these fillers have different properties, like I said. So it's a gel. Some of them are more cohesive than others. So if I should have brought some. That
You
would have been
actually
fun.
did do it for me in the office.
Yeah.
You squirted 2 different syringes
Yeah,
out.
yeah. So you can squirt some out, and first of all, you squirt it out. You see, there really isn't so much in the syringe at
Right,
all.
it's very small
It's tiny.
amount.
It's like an eighth of a teaspoon.
Yeah.
Then you could play with it. Some of them are meant to not they're not sticky in a way, and you can just like spread it very thin on like a flat surface, and you'll see it spreads
It's
out very
super
nice.
watery, yeah.
Yeah, and then some of them are kind of sticky, and if you put them between your fingers, it's like
More
glue-like
like putty
almost.
gel, yeah.
Exactly. And it has to do with how they process the molecule. So some of them are cross-linking these hyaluronic acid molecules into like a weaved net, and those products tend to last longer.
Okay.
And the way some of these products get broken down is by your macrophages, your part of your immune system kind of chews them up, turns them into water, and it takes them away. But when they're cross-linked into like a little net or a fabric almost, and they're very cohesive, it tends to last longer. And that's the selling point for some of these.
Totally.
Is these cross-linked hyaluronic acid
Like you don't need
molecules
to come
will
back for
last.
16 months.
Right, it'll last longer. It's stretchy, so when you smile, it's not moving, and that's true. And you want to use those for certain areas of the face, but it can linger. And I've seen some MRI reports of it lasting or coming up on MRIs maybe 5 years out versus what we always say is like it's gone in a year. I think most of it is gone. I think the noticeable effects of it are gone within a year or so.
Okay.
And how much of it actually sticks around really depends on the product, the specifics of the product, how much is injected, and where it's injected. Certain areas of the face are less mobile and they have less blood flow. So under the eyes, typically that'll last closer to a year. If you get into the eye socket, if you have a weak injector that gets into the orbital septum, it can stay in there for 7 years. I mean, and there could be like a little bit of a lump for a longer time. And that's when you start considering dissolving things. Like
Right.
Not 7 years, but when you notice it's still there.
Right. So before we do dissolving, what about migration? Like, is it more common with like the super watery one because it moves more fluidly?
The
And like,
less cohesive ones, the thinner ones, because they're smaller molecules, there's different sizes to these hyaluronic acid molecules, and they filter them and they go by size. So the ones with the smaller molecules that are not cross-linked will have more of a chance to spread out if they bind a lot of water. I think that kind of gives the illusion of it spreading out to other areas.
and what is the bad? I mean, like, besides
What's wrong with that?
Yeah, like, is that a health risk? Is it an aesthetic risk? Like, what is the main risk with that?
More of immediately more of like an aesthetic risk. So if I take a very thin, watery product that's made for the lips because the lips are soft, and I put that into the cheek, deep onto the bone, hoping that it's going to like push against all of the weight of the cheek, fat, muscle, all of that. It's just not. It's the weight of that tissue is going to spread it out, and immediately you'll just see that it's not so much migration; it's about spreading out and thinning.
Right. So you're not getting the look you
this,
want for
yeah,
very
how
long.
much of this is actually like making its way through the tissues and moving? I don't know. I don't think it's as much as people may consider. I think what people are calling migration is going to be more like puffiness, swelling related to water retention or blockage of lymphatics.
Okay.
More than the actual product lingering.
So it's more about like where it's being injected and the
how and which
method.
product.
Yeah. Okay. Interesting. All right. Let's talk about dissolving. I heard it's the worst pain in the world. It's like the tattoo removal
That's
of
funny.
aesthetics.
That is a good way of putting tattoo removal. I mean, I don't know if it's as painful as a tattoo removal. That's pretty bad.
Okay.
It is.
What is the process?
Okay, so first off, you want to make sure that you want to dissolve the product.
Sure.
So first off, you want to make sure that you're not in a position that you are dissolving product, meaning you don't want to
get there.
Yeah, just the best offense is defense on this one. You just don't want to have to dissolve the product, but it happens. And so the first thing you want to do is be like, okay, I feel like my, let's say, cheek is overfilled. If you had it filled within like a month or two, maybe wait it out and see how much of it goes away on its own.
Okay.
First month, some of it might just be swelling. Beyond that, some of it might just deflate, and that's it, and you don't need to go through this whole process.
Right.
Next, you want to see, okay, is there like a palpable lump or bump that I want to target? Or has this been fanned out and it's like a general area? And you have to also ask yourself, what am I going to do when this stuff is gone and it's a little deflated? Am I going to do both sides? Is it one side that's bothering more than the other? Because you have more control putting the product in and less control taking it out. The way it comes out is an enzyme getting injected, and it converts this hyaluronic acid, kind of melts it into water, and then the body takes it away. How much of it gets dissolved depends on how much of the enzyme you're putting in. Are you making a direct hit to where the filler is, or you're just spreading it out in the area? Are you diluting it? How much of it is going to go away? So in an emergency situation where, there's vascular compromise, the blood flow is blocked, you kind of just have at it, and you want that stuff gone so that the blood flow restores. If it's a puffiness thing, you're going to go lighter and lighter, and you're going to have to, over a few sessions, see where you're happy with it.
Okay.
And if you over dissolve it, it's fine. Your body will eventually make some of that hyaluronic acid back, but you're probably at this point going to have been used to having the fuller cheek, for example, and you're not going to love the cheek
You're not
now.
gonna like how it looks. Yeah.
You have to be ready for that. And okay, so what do you do now? Do you put more filler back in a better place, maybe a better selected filler? Do you do some fat or nano fat injections, which have other issues?
Yep.
Or you're just going to leave it and maybe do a lift, like a surgical facelift, something to actually pull on the skin rather than inflate the face like a balloon.
So why does it hurt so bad? Can you rank it 1 to 10? Like 10's getting hit by a car.
I haven't had anything dissolved, so it's very hard for me to say.
So it's great point.
As far as
Great point.
patients doing it, I think
Like, what do other people seem to say?
It burns almost the way that a numbing injection would burn, I would say.
Okay.
And usually when there's burning, it has to do with the acidity of the product going in. So when I inject lidocaine, it burns. So because it's more acidic, and the body is a different pH, and that the body doesn't like that sensation. So it's very short-lived. After it goes in, it burns for like a few seconds, and then it mellows out. And it's not.
So it's like immediately.
Yeah. Oh, yeah. You're not having pain from
not
this for a long.
lasting.
No. It's a few seconds of burning, maybe some soreness because there's some poking and prodding with the needles. But
how long does the dissolving process take? Does it dissolve while you're sitting there, or does it take a couple
It can,
weeks?
yeah. It starts working immediately. Like within 10 minutes, sometimes you can really see it kind of deflate a bit.
Wow.
The enzyme maintains activity for anywhere from 2 to 3 weeks.
Okay.
So you don't want to be injecting more while this is active. It's just going to interfere with the process.
Sure.
And I think you want to commit yourself to maybe 2 or 3 sessions of dissolving to do it slowly and to do it right.
Okay. I love it. Okay, let's do some rapid fire questions because we need to wrap up.
Okay.
These are questions from the audience, and I'm just going to read them in a random order as they come up. Lip flip versus filler.
Lip flip, very minimal. It gets injected here for the movement
On the top of the
top
lip?
of the lip. So basically, it relaxes the muscle, so you get a very minimal lift. I think, mid. A lot of people don't like see a difference. You'll have difficulty drinking from a straw. Some people like it. It's if you really want to try it, it's safe to try for the most part. Filler is a little bit more of a commitment because it's like a product that's going to stay there. But it's definitely done tastefully. You're going to see a much more robust result.
Facial threads, yay or nay?
I don't do them. I don't like them. There's
Why?
2 kinds. One, they don't. If it's a dissolvable thread, basically these are barbed sutures that are going and lifting the skin only. And anytime you pull on just the skin, it has a tendency to not last. So thread lifts will last about 3 months or so. They're rather expensive. They're not super painful, but you can sometimes see the threads. This is not a new thing. About like 30 years ago, people were doing permanent threads. So there's, permanent, it'll last longer.
Do you have a line that's tight and then the skin sags around it?
You won't see it, but it causes some scarring internally, which acts as like lifting.
Okay.
But I had a patient who did it in another country who had like the weirdest bacterial infection like 30 years later. I mean, we needed her on like IV antibiotics. It was a slow growing, difficult thing. So permanent threads in like thread lifting. No, I've had a patient who had thread lifting in her nose. Do not do that. Do some other things. Yeah, it was an unpleasant surprise to see in the operating room. Like you're just pulling these things out. Any permanent threads that are like spanning a large distance are going to be a nidus for infection potentially.
Nice. Kate, Botox and filler during pregnancy, why is it like a no-go?
Botox itself, it's a toxin. It can get transmitted through the breast milk potentially. So anything with pregnancy, you have to be super careful. With the fillers, it's the lidocaine in it. So some people suggest doing like a pump and dump situation, like pump the breast milk and don't use that one. That's a question for your OB. Personally, I'm very conservative. I don't like to do any of these things during pregnancy or breastfeeding.
Okay. Effects of Botox and filler on autoimmune conditions, people with autoimmune issues.
There are certain medical conditions that you do not want to treat with Botox. So one of them is myasthenia gravis, which is there are people who actually have antibodies that are like attacking muscles and they have weakness, and you don't want to start injecting toxins that stimulate the same kind of antibodies they already have and they're already sensitized to, because it can trigger a flare-up. General autoimmune, I personally haven't seen any with my patients, and I know there's like a big kind of, there's some rumblings about these things. I haven't seen anything personally.
Okay. And then the last one, if it were you, what would you never do? What procedures or what like injectables would you never do?
I think permanent thread lifting, definitely not worth it and not worth the risk. I like the dissolvable fillers, but some fillers that are permanent, such as like Radius is a little thicker. It's calcium based. You can't dissolve it. If you have a problem, it's a little more difficult. I wouldn't say never, but much less. And Those are the two I'm going to go with right now.
I love it. Dr. B, I have 4 more pages of questions for you. So we have to wrap the episode here, but I think we have to do another one and we'll talk more about plastics.
We'll do
and
more surgical
skin
next time.
And go even deeper. And maybe you and your brother come on. Because for those of you listening, Dr. Bassiri does collarbone up and the other Dr. Bassiri does collarbone down.
If you Google us or me, it's a guy that looks just like me, my younger brother. People go to his office, my office. They get confused. We're not twins. I'm facial plastic surgery. He's plastic surgery. And so it's very confusing. And we should have a podcast just explaining that there's 2 of us. I think that would be like the best of it.
You told me about a conference where people thought you were the same guy all weekend.
Constantly. I've gone on dates where people thought I was him. It's not even a.
That's amazing. Okay, plastic surgery. You and your brother will do like collarbone up and down.
Yeah.
Great.
Yeah, let's do it.
Okay. Thanks, Doc.
Thank you.